Dr. Porselvi Rajin, consultant medical gastroenterologist in Apollo Hospitals, Chennai. So I practice here as a full-time consultant. The common problems with which the people approach us in a day-to-day basis are gastroesophageal reflux disease, IBS, celiac disease, hemorrhoids, bleed PR, unexplained weight loss, anemia, etc. So the today's discussion is about irritable bowel syndrome, which is the most common question most of the population come to us with. So what is irritable bowel syndrome? Irritable bowel syndrome is a functional bowel disorder. Previously it was known as spastic bowel. It's a functional gastrointestinal disorder which is explained by a combination of symptoms, particularly pain abdomen, bloating, flatulence with altered bowel habits. It's generally classified as 4 major types with the predominant symptoms like IBS-C, which is constipation predominant IBS, IBS-D, which is diarrheal predominant IBS, IBS mixed or alternating type, and IBS of unclassified. Generally, this has etiology. When it comes to the etiology, it is because of some disturbance in the gut-brain axis, gut motility, gut infections like small intestinal bacterial overgrowth, pain sensitivity, food sensitivity, or also certain genetic factors and immunological factors plays a role here. So it affects the quality of life to a great extent, and also it affects the quality of work, life, everything for young individuals generally. So this can be diagnosed as a diagnosis of exclusion, provided other etiologies like commonest includes inflammatory bowel disease, other polyps or inflammations, malignancy of the bowel is excluded. So irritable bowel syndrome is predominantly a diagnosis of exclusion. It affects majority of females more than male predominance is there, and the diagnosis will be by certain diagnostic criteria with the combination of symptoms. When this patients presenting with irritable bowel syndrome, the treatment is based on certain diet and lifestyle modifications. Diet includes a low-FODMAP diet. Low-FODMAP is nothing but reduce the fermentable oligosaccharides, disaccharides, monosaccharides and polyols in diet, meaning lot of this garlic, onion, this beverages and breaded meat, all these fermentable sugars has to be avoided. So low FODMAP diet. But point to be noted here is these low FODMAP diets will reduce the digestive symptoms to a short extent. It can be used for a short duration, but in long term it has a negative effect. For example, it causes a very bad detrimental effect on the gut microbiota and metabolomes. So the other diet pattern to be considered here is high fiber diet. So this high fiber diet, it helps in both IBS-C and D. In IBS-D, that is diarrheal predominant type, it helps as a bulk forming agent which produces a soft stools. In IBS constipation type, it helps as a stool softness. But point to be noted here, soluble fibers and insoluble fibers. Only soluble fibers like psyllium and isabgol helps for relieving the symptoms, whereas insoluble fibers like bran, it has a negative effect. So generally I advise my irritable bowel syndrome patients to be on low FODMAP diet for a short extent and reduce the stress, have more physical activity, eat timely food, have good sleep, hydrate them well, and use more boiled steamed foods predominantly, and also high fiber diet.